Are you having plastic surgery and you got your labs done and you really don't know what they mean? You're not alone. Let me teach you, let me show you what the lab values mean and why we get them and why they're important and what are they all about.
Maximal projection. We want this line to be smooth. Not everyone lipos in the key area. I've got some labs here and I'm just going to go through some of these values just to give you an idea of what's going on. Remember, taking your blood and doing a laboratory values on it is just a snapshot of what your blood is at that moment. Here I've got a set of labs. This is called a CBC, which is a complete blood count. There's really three main cells in your blood. There's platelets, which are things that go and stop the bleeding. There's hemoglobin, which is what carries the oxygen to your body. And there are white blood cells, which fight infection. So you see here in this person's labs, her white count is 5.8. This is the usual range, 4.5 to 11. 5.8 is a normal white count. It's really rare to get labs and somebody has an abnormal white count, because if somebody's ready for surgery and they're healthy, then the white count's normal. And 5.8 doesn't mean anything different than 10. It's all the same. As long as it's within that normal range, it's fine. Lower doesn't mean you're not ready for infection, or higher doesn't mean you can fight infection more. That just happens to be the value. It's a normal value. Hemoglobin, this is a big one. Hemoglobin here, her hemoglobin here is 13.4, which is very good. The normal range is 11.5 to 15. So when your hemoglobin goes down, you don't have the ability to carry oxygen as well when your hemoglobin is high. Consider the hemoglobin like a set of train cars. All of those little box cars are carrying hemoglobin, which carries oxygen. So the more cars you have on your train, the longer your train is, the more oxygen you can carry. And so it's important to have as many box cars as you possibly can. And you can see the normal range here is 11.5 to 15. Here her hemoglobin is 13.4, so that's great. If her hemoglobin here was 11, that would be a problem and I would not be able to do surgery. I do use the cell saver when I do surgery for lipo or BBL, and that will scavenge, that will retrieve some of the red blood cells and the hemoglobin back from that fat. But it's not the same as normal hemoglobin, because you can have this much blood, but some of those red blood cells are broken. And so that may look like you're putting in more fluid than you are. So I always think to myself that the cell saver gives you about 1 point. So if you're at 11.5, then with the cell saver, it's like you're starting at 12.5. Now look, there's a whole bunch of other things in here. None of these things really matter to us for the purposes of this. And the one that does matter though is platelets, okay? And that's there, and there's a range, 130 to 500, so it's a big range, and anything within that range is totally normal. It doesn't really become a problem until your platelets really start dropping like below 50, or if they're above like 1,000. So there's a much bigger range for platelets when they're kind of important or a problem for us. Look at all of these things here. So these are neutrophils, lymphocytes, monocytes, eosinophils, basophils, all these types of things. Usually these are all subsets of a white blood cell. So they're different types of white blood cells. So this WBC, which is your white blood cell count, reflects how many white blood cells are in your blood at that time. And it's made up of all these different, and they give you a raw number and they give you a percentage. For us, this is not important. Once in a while, I'll see somebody, they may have a little slight elevation of their monocytes or a little slight elevation of lymphocytes. Their total white count's normal. It doesn't really affect us. It's not important. It's not clinically relevant. Remember, there's always a difference between a laboratory value and then what's going on with the patient. And that brings up a whole nother topic, which I won't get into, but I'm just going to touch on it. If we took your blood right before you went into the operating room and say your white count was 5.8, and then we took your blood and measured it right when you left the operating room, your white count's going to be high. it's going to be higher than this 11. It's going to be higher than the normal value. We know white blood cells fight infection. These are all parts of the white blood cells. So does that mean within that 2 or 3 hour period of time, you developed an infection? No. What that means is your white blood cells do something what's called demarginization, which just means they're kind of floating around, they're sticking to the walls of your blood vessels, they're hanging out, they're ready to fight an infection. So they're hanging out, but they're not really involved in things. The white count's normal, it's 5.8, but there's a big stress. Well, your body doesn't know if having liposuction is a car accident or anything. It just knows it's a stress to the body. So those cells leave the walls of your blood vessels and they come out, and then we can measure them because we're measuring what's floating around in the blood, and then your white blood cell count will be higher. It doesn't mean you have an infection. If you get an infection after surgery, it doesn't happen within 2 hours. That usually is happening 2 or 3 weeks or sometimes even a month later. So it's important to kind of understand the relevance of a lab with respect to the patient and not just look at the lab and say, oh, the white count's high, this patient has an infection. The next thing we look at, coagulation, basically means blood clotting. So we want to make sure that your blood clots appropriately because we're going to be operating, we're going to be creating bleeding. And if your blood is not going to clot and stop the bleeding, then obviously that will be a problem. And so there's various different things that we look at. Some of them are relevant and some of them are not relevant for what we do. The PT, the pro time, is. And that's given in seconds because it's a timed how long your blood clots. So as long as it's within this 10 to 14, hers is 11.4, then that's normal and that's fine. But if the PT is elevated, if the PT here is 17, then you wouldn't be able to have surgery because the blood is not going to clot in an appropriate amount of time, and that could lead to more bleeding, and that could create a problem after surgery. It's correctable, but you'd have to go to the hospital, you'd have to get different types of therapies to increase your blood's ability to clot. So if the clotting is off within the pro time here, we would postpone the surgery until we figure that out. Anything in this area with the red bloods, with the complete blood count or the coagulation panel, either one of those things, if they're off significantly, you would see your family doctor to talk about it, and they may send you to a hematologist. That's who specializes in this. Something else we get is just a chemistry panel. And so you remember from chemistry class, you have sodium and potassium and chloride and things like that. And that's all of these. These are all electrolytes. These are so important for how our heart beats. Every single cell in our body has to have the appropriate concentration of sodium, potassium, chloride, magnesium, phosphate. All of these things have to be within a very close range, otherwise we die. So these are usually, we get them, they're important, we want to make sure they're normal. Once in a while we'll pick up something like, oh, you have a very low potassium level, we're unable to do your surgery for that reason. But it's not likely for patients to be healthy and walking around and have these out of order because they would be sick and they would be in the hospital. Glucose is the sugar that's in your blood, we measure that. That even for patients that will say they have hypoglycemia, it's usually normal. There's a pretty wide range between that 70 to 100. As long as it's within that range, it's fine. BUN, blood urea nitrogen, that's just a protein breakdown product. So your body is always recycling protein and breaking it down and rebuilding it. And the urea is something, the nitrogen, gets excreted, it's a byproduct of that protein being broken down. And so that gets excreted by the kidneys. So the BUN it gives you an idea how the kidneys are working. The other one that gives you an idea how the kidneys are working is creatinine. But creatinine is a different one, and it reflects a little different part of renal function, kidney function. So that has to be normal. I don't mess around with any abnormality within the creatinine. The normal here is up to 1.4. If it was 1.5, you'd have to be looked at because you can have some renal impairment or kidney impairment. Your kidneys aren't working as well, and it'll start to be picked up by the creatinine. So if that's elevated, then that's a warning sign and we don't proceed. These other two that I'll talk about here are interesting. These are AST and ALT. And what these are these are labs that are reflective of your liver health and your liver function. AST and ALT can get released if your liver has injury. You'll spill more, your liver cells will be injured, they'll die, they'll open up, and they'll release these products, AST or ALT. Different things, different injuries affect the AST and ALT differently. So AST, if you go on a bender for the weekend, on Monday, it's probably a little bit high because the alcohol has damaged the hepatocytes, the liver cells. ALT, usually what we see is a reflection of fatty liver disease, and that needs to be explored by your family doctor. Hers is 13, 54 is the highest. If her AST here is, still in the 50s, that's really not that big of a deal. But if they're up in like the 300-400 range, then that's more of a deal. The liver enzymes can get really high. So people that have like pancreatitis and gallstones and all other types of things, hepatitis, those LFTs will get into the thousands. Thyroid studies. There's quite a bit of flexibility here. The most important thing is that T4 and the T7 are normal, which means your thyroid level is normal. If your thyroid level starts to go down, you'll see this one here, the TSH, the thyroid stimulating hormone. You'll see the TSH start to go up. And it's kind of like, hey, thyroid, wake up. You got to make more of the thyroid, thyroxine that you make. So we look at these two things together just to get a window into how the thyroid is functioning. There is, the TSH can actually go beyond the normal level here, and it's still safe to have surgery because the thyroid levels are okay. And so that's a little bit of a nuance, but it's something that we check. And most of the time, these labs are normal. But I can tell you, over the years, I've picked up quite a few patients who've actually had thyroid disease that they never really knew until they had their thyroid levels drawn for surgery. And then we see like, whoa, you're hyperthyroid. HbA1c. If you look here, this is a normal range. We like it to be below 5.7. This tells us about the level of glucose. So we go back to the chemistry here. We have glucose here. Look at her glucose here is 77. It's normal. So the higher your glucose normally is in your blood every day, the higher your A1C is. And the A1C gives us a description. It tells us what the story has been for the last 3 months with the blood glucose level. So when you take a lab and you measure glucose, you're just finding out, Tuesday at 11 a.m., glucose was 77. But it doesn't tell you the full story. What has the glucose been over the last 3 months? Well, the glucose is normally, 130 over the last 3 months. Well, that's high. And the A1C will then be high. And so it tells us for patients, particularly that have diabetes, type 2 diabetes, for example, how good of a job or how bad of a job are they doing controlling their blood glucose? So blood glucose is wildly fluctuating. If you eat a donut, woof, your glucose goes way up. If you're not eating for 8 hours, 10 hours, your glucose is going to come down. There's certain things that your body does to increase the glucose and to try and decrease the glucose to try and keep it as normal as possible. But if you have a disease like diabetes, you don't have that control anymore. So you really have to be careful with your diet in order to keep your A1C within that normal range. So the A1C should be less than 5.7. If it's greater than 6.5, that's the diagnosis of diabetes. If it's lower, 5.7, 6.4, that's what we call, normal, non-diabetic. And it's kind of in between those two ranges, that's a pre-diabetic. So if somebody has diabetes and their A1C is less than 7, I will operate and it's safe to operate. Why are we even worried about what the glucose level is? How is that even important? The higher your glucose level, the higher the A1C level, greater your risk of having healing problems after surgery, increases your risk of infection. So, does that mean everyone that has an A1C of 6.9 will get an infection after surgery? No. But we know with the data, the lower we can get the A1C closer to normal, the less likely they are to get an infection. They can get into the normal range of somebody who doesn't have diabetes, get into their risk level for having an infection. So A1C is very, very important. If it's higher than 7.0, I don't perform elective surgery. If you go into the hospital from a car accident, then yes, of course, they're going to operate regardless of whatever your A1C is. But for elective outpatient surgery, we want the A1C less than 7. Beta-HCG, your pregnancy test, and we do that with a blood test as well. That's a very simple negative or positive, obviously. And then we'll get an HIV test, and that's either reactive or non-reactive. And if it's reactive, that doesn't necessarily mean you have HIV. It just means you need to go on and do another test or series of tests to confirm that you had HIV. In a nutshell, that was the labs. Thank you for staying with me. I can see like there's 2 people out there. Thank you. You guys did a really good job hanging in there through all of these labs. If you have questions about the labs, then please, by all means, leave a comments. If you're really just absolutely passed out on the couch now, God bless you. Have a good night. Thank you for watching. And I'll see you next time on another episode of Behind the Mask, Season 4.